Could you introduce your name and what your profession is?
Myself is Dr. DHARIT SHAH, and
Hmm.
I am graduated from Ahmedabad, Gujarat. It is in the India.
Hmm.
My degree is MD Respiratory Medicine, a consultant pulmonologist and allergy specialist in Ahmedabad, and affiliated with HCG Hospital as a full-timer pulmonologist.
Look at that. Do you want to ask the second question?
The second question is, what does the day-to-day life look like with your job? So how does a basic every a normal day look like in your work?
Like basically, what kind of profession will leads to COPD?
Yeah.
So basically, the profession, the person who is attached with the profession, like road making, either cotton mill workers, any kind of chula smoking, then factory work, chemical factory work, person who is having a habit of smoking, tobacco chewing. These all are the leading factors that
Okay,
can
and
lead to COPD.
thank you. And what are some effective treatment options or strategies for managing COPD symptoms?
Basically, first we have to investigate the patient first. There is called pulmonary function test, PFT. PFT is the tool in that we can first diagnose whether it is COPD or whether it is asthma. COPD is irreversible, asthma is reversible. So if your patient is diagnosed with COPD, we have to give them inhalers like bronchodilators. So inhaler is the first stay of treatment for any patients who is suffering from COPD.
Thank you. Shri, do you want to ask the next question?
So how many patients with COPD do you think you would see in a day or a week?
I think there are mixed number of patients. The new patient in my clinic or in my hospital, there are 1 to 2 patients who are diagnosed with COPD in recent days. But if we can add the already diagnosed patient, that are 7 to 10. So within the hospital per day, there are 7 to 10 patients who has COPD. Either it is a new case or it is a previous case.
Okay, thank you. Look at that. Do you want to ask the next question?
And what are some common risk factors or causes of COPD that patients should be aware of so they can prevent developing COPD in the future?
First is the pollution. Pollution itself a major risk factor. Second is the smoke, any kind of smoke, either it is a factory related, either it is pollution related, either it is smoking related. Third one is the addiction. The main most common cause is smoking, tobacco, or either tobacco chewing. And in women, if they are uh, doing their cooking work from chula, in India it is called chula smoking. We have to blow the woods, and that can generate the reheating of that woods, and it will generate the fumes in the air. So while cooking, they have inhalation of the chula smoker. So there are 4 major risk factors.
And to follow up on that question, can kids obtain COPD early on due to environmental, like being in areas of pollution or inhaling the Jula smoke?
yes, it is a prone to the patient who has this kind of habit or the area where they live. It is the major causative factor, but COPD won't develop within days. It will develop within years. So daily cumulative exposure, where when it is increasing day by day, the chances of developing COPD is more. So it is not a acute event, it is a chronic event.
Okay, thank you for your response. Shriek, do you want to ask any questions you have?
Yes. Um, how do you think, like, with the patients that you're seeing every day, how is like COPD affecting them? Like, if it's getting worse, how does it look like? If it's getting better, how does it look like?
The major problem in India or in the world is COPD were diagnosed, the patient who has or who had a COPD, they were diagnosed in a late age of their age span. I think more than 40 year of age, they will diagnose to have COPD. So if we can conduct a community awareness, as early the diagnosis, as early the treatment, which is the most favorable and treatable condition. So if your patient is coming late in 50s or 60s of their age span, it is basically difficult to treat COPD. But if you are diagnosed in early age of the span, I think 30, 40s, so the treatment options are more rather than the late age span.
Thank you. Likita, do you want to ask the next question?
Okay. The next question we have is, are there any lifestyle changes or habits that that patients can use to prevent the progression of COPD or the risk of developing COPD?
The main avoidance is avoid the causative agent. So if you have pollution is the problem, avoid the pollution by using mask. If you have a habit of smoking, avoid the smoking or stop the smoking is the main cause of treatment. And third one is do the regular chest physiotherapy. If your musculature of the lung muscular muscles are more fit, it is less chance to have COPD in later stage. Few of the patient does not have any kind of exposure, like no pollution, no addiction, no chula smoking. Still they have COPD in their late age of the span. So muscle is also a problem, that in the late age muscle weakness will be there. So your lung will not inhale and exhale properly, and the patient will develop the COPD. So as the early your age, do the chest physiotherapy to strengthening your muscle, respiratory muscle. So these three are the preventive measures: avoid the exposure, stop smoking, and chest physiotherapy.
Thank you. And to follow up on that question, and when we did some research, we found out that COPD is one of the leading causes of death. And
It is the second or third most common cause of death all over the world.
yes. And we were wondering, why do you think COPD is a leading cause of death, and why are the numbers increasing every year?
Because it is the iceberg phenomenon. We can't see the rock which is inside the sea. We can just we can see the rock which is above the water level. This is the same phenomenon in COPD. The actual number of patients are very, very, very high, but the awareness, the investigating power is less, so that they can uh, They know that they are suffering from COPD in very late stage, so it is not proper time to get it like in to get it in a reversible manner. So if we can educate the general population, like they are regularly checking their blood investigation in a year, either they are doing the ECG, electrocardiogram of the heart for that heart checkup. Likewise, we have to educate them that yearly you have to check your lungs also. And for the lungs, there are 3 to 4 investigations. One is pulmonary function test. Second one is the X-ray. So get it done in a yearly manner so that if there is any decrease in pulmonary function test, they they can diagnose the COPD in early age of their span.
Okay, thank you for the information. And another question we had was what further conditions or health risks can COPD lead to?
COPD is majorly 3 to 4 symptoms based problem. One is cough. Second one is the cough with expectoration, breathlessness, and chest heaviness. So for these 4 reasons, if we can give the pneumococcal vaccination is also a preventive measure for COPD. There are 3 to 4 vaccines available all over the world. One is the viral vaccine. It is called flu vaccine. And second one is the pneumococcal vaccine. It is pneumococcal 13 and pneumococcal 23. Because in COPD, there are high risk that the patient can develop secondary bacterial infection, which is called as pneumonia. So if we can give the proper vaccination in proper time schedule, we can prevent the COPD exacerbation.
Okay, thank you. And I think Shri had one last question.
Yes. So, what do you think kids and teenagers should know in order to like prevent
Teenager
getting
is the
COPD?
most Teenager is the most prone age that if you are standing beside the person who is smoking, like I am not smoking the cigarette, but the another person who is standing beside me and smoking a cigarette, the second hand smoke, which is a most common causative agent to develop COPD in the person who does not even smoke a single cigarette in their life. But if you have in an area that 4 to 5 people are smoking and 2 to 3% in that group are not smoking the cigarette, but the burn chemical from the smoke from the cigarette, it is called second hand smoking, which is more prone to this teenage group, that even though they are not smoking a cigarette, but in later of their age, they can develop COPD without any smoking. So in teenager, we have to educate them that you have to use mask or avoid the group in which if you are not smoker, just avoid that area in that any one of your colleague or friend who is a smoking.